Hi, I'm Dr. Matt Russell, and I'm going to be talking about some of the common myths about laser eye surgery. Significant number of concerns people have before they go ahead with laser vision correction come from information they've received from their family and their friends, or even eye professionals who aren't well informed about laser vision correction. In this video, I'm going to help clear up those misperceptions. Myth number one: astigmatism cannot be corrected. This is one of the most common things we hear. No, it's not true. Up to 98% of us have some degree of astigmatism, and we've been correcting astigmatism with LASIK and PRK since the beginning, since the 1990s. We can correct astigmatism with all types of laser, LASIK, SmartSight, SMILE, and PRK. What's more, we can accurately correct relatively high astigmatism levels up to 5 units with laser vision correction. For patients with extremely high levels of astigmatism, ICL insertion is also very effective. So yes, if you've got astigmatism, it's very likely you can have laser vision correction, and if not, ICL insertion. Myth number two: the flap never heals. This is entirely wrong. It's on the internet. The flap never heals. False. The flap is locked into position within a few hours by the corneal epithelium. We know that the LASIK flap is very adherent and healed to the cornea approximately 4 weeks after laser treatment. At this point, people can return to contact sports. After 4 weeks, it would take severe trauma to dislodge the LASIK flap, which would involve the type of injury you should be seen by a specialist anyway. Surgically, it is possible to raise the flap up to 10 years following treatment, but this would require a surgical procedure because of the high level of adherence between the flap and the underlying cornea. After LASIK, the cornea's surface layer, the epithelium, has healed over the LASIK flap, holding the flap into position within 4 hours. The flap starts healing to the underlying cornea within 3 days and is very adherent within a week, enough that you can safely return to regular routine exercise. It's highly adherent at 4 weeks, and contact sports are fine at that point. So no, the LASIK flap does heal relatively quickly. So another thing to consider if you're really worried about the concept of the flap, you can have flapless surgery, SmartSight or SMILE, which is minimally invasive keyhole LASIK. There's absolutely no pain. The recovery is basically overnight. And because there's no flap, you can get right back to normal day-to-day activities and regular exercise, as well as contact sports, within a couple of days of your treatment. I've had RK surgery, so I can't have laser to correct my vision. RK surgery was relatively common up to the 1980s and was still being done up to about 2000. Many people who underwent RK still had a prescription following the treatment, or developed high degrees of regression and subsequently had been left with a prescription that required glasses. In fact, laser vision correction is an excellent treatment for many of these people because they often have irregular astigmatism, which means they often don't have clear vision even with glasses. PRK and transepithelial PRK are two treatments that can be used to regularize the cornea, remove the irregular astigmatism, and correct the residual prescription after RK, and the results are excellent. So it's important to note that you can't have LASIK or you can't have SmartSight or SMILE if you've had RK, but you can have surface laser PRK or transepithelial PRK, and these are excellent treatments in this situation. Suppose for some reason the prescription was too high for PRK. In that case, ICL insertion or refractive lens replacement are also excellent options to eliminate the need for glasses in this situation. The other thing that's very common for patients who have had RK is that they're now at the age that they're developing cataracts. You may be considering improving your vision through cataract surgery if you have an early cataract. Still, many patients who undergo RK surgery will require additional laser correction following their cataract surgery to achieve a reasonable degree of freedom from glasses. So to answer the common myth, I've already had RK, so I can't have laser vision correction, that's just simply not true. You can have laser vision correction in many cases, and if you're not a suitable candidate for laser vision correction, then refractive lens replacement and cataract surgery combined with PRK offers very high chances of achieving freedom from glasses. Because laser will correct many of the irregularities caused by RK, your vision quality is often better than it was after you originally had your RK treatment. So the next myth is very common. I will still need glasses after laser eye surgery. The large FDA study run in the United States Looking at laser vision correction outcomes showed that 98.5% of patients who underwent laser were satisfied with the significant improvement in their vision, and 93% of those patients achieved perfect vision. That study was performed many years ago, and the results of laser vision correction have improved since that time. At present, we find that 98% of patients after laser vision correction with LASIK in our practice will achieve vision of 20/20 or better following their initial treatment, and 2% of patients require an additional treatment to achieve that high level of vision correction without glasses. That means nearly 100% of patients do not need glasses following their laser vision correction. At Vizon, there's no additional cost for treating any residual prescription following an initial laser vision correction. A few people develop regression. A small amount of their original prescription will come back, which usually happens within the first 2 years of the original treatment. Regression happens in about 5% and perhaps up to 10% in some cases of people, and the rate depends on the original level of the prescription. A higher prescription results in a higher chance of regression. Almost always, it's relatively straightforward to add an additional treatment simply by lifting the LASIK flap and adding a small correction to achieve an excellent visual outcome. At Vizon, there's no extra cost for treating regression within 10 years of your original treatment if you are short-sighted, or within 5 years if you were long-sighted. It is important to remember that laser vision correction makes you normally sighted for your age. So that means if you were in your 20s or 30s and underwent laser vision correction, you would no longer need glasses after that treatment. However, it's normal for normally sighted people in their late 40s to start to lose their ability to read and need glasses to help with this. It's not the effect of the laser wearing off. That's a normal, natural process called presbyopia. In most cases, when this happens, we can add some reading vision to one eye with additional laser treatment called laser blended vision to restore the reading capacity. So the answer to this myth is no. It's extremely unlikely that you would need glasses for anything after laser vision correction. If you've had laser vision correction in the past and you're now needing glasses for reading, or you'd like to have a better solution than what you've currently got, get in contact with us. I suspect you've had some regression following your previous treatment, or you may be getting to the age that you're developing presbyopia and losing your reading vision, and there are a number of different options that can help restore your vision back to a great level, both for distance and for reading. Another myth about laser vision correction is that laser vision correction causes permanent bad dry eyes. This is another big myth. LASIK does cause some degree of dry eye after treatment in almost every case. However, the dryness is temporary in nearly everyone. Commonly, this temporary dryness is minimal or moderate and rarely severe. The dryness is most prominent in the first month, and common symptoms are the vision is blurry after working on the computer for most of the day, but improves with artificial tears or with resting. The vision fluctuates with blinking, and the eye feels tired towards the end of the day or at night, and there is starriness to headlights when driving at night. If the dryness is moderate, then there may be grittiness, irritation, sensitivity to bright light. People who have dry eye symptoms generally improve back to the level that was normal for them within 4 months. A small group of patients are slower to return to normal, so 10% of patients have some symptoms that persist for between 6 and 12 months, and there's a very small group of patients who have symptoms that persist for longer than this. Under 1% of patients have symptoms that last longer than 2 years. Severe chronic dry eye syndrome is in fact very rare following laser vision correction. The best way to avoid developing dry eye after laser vision correction is to undergo high quality screening for any pre-existing dry eye syndrome before you go ahead with your treatment, to treat any mild dry eye symptoms before the laser treatment, and to treat the expected early dry eye after laser vision correction with regular lubricating artificial tears. You can check our separate video on dry eye after laser vision correction. If you are at high risk for dry eye after laser vision correction, particularly with a prescription that's higher than 7 diopters, then we would recommend a procedure with a low risk of dry eye issues. SmartSight or Smile, which have much less dry eye than LASIK or PRK, or even consider an ICL insertion which has no long-term risk of worsening or causing dry eye syndrome. These may be the best options for you. Now, we all get slightly drier eyes as we age, and this happens to a greater degree in some people and can even start in our 20s and 30s. So, if dry eye develops years after laser vision correction, this is not related to the laser vision correction itself. It is likely something that you're prone to and may have developed, and most likely would have developed, if you'd never had any treatment done whatsoever. Also, our eyes will be naturally drier with certain activities, so extensive computer work, reading, air conditioning, and windy, dusty environments can also cause our eyes to be relatively dry. So no, LASIK or PRK, and particularly SmartSight or Smile, do not cause bad, permanent dry eyes in almost but the rarest of cases. The most important thing is to have a detailed assessment and consultation with your specialist before you go ahead with any treatment. Also, go to the clinic that offers a full range of vision correction procedures so that you do not inadvertently have LASIK or PRK when there may have been a better option for your particular situation if you have dry eyes to begin with. This is a really common myth. I can't have laser vision correction if I'm farsighted. This is really common. No problem again. Most people who require glasses are nearsighted, but there's a fair number of people out there who are farsighted as well. Their prescription has a plus in front of it instead of a minus. We can treat farsighted people with LASIK just as we can treat short-sighted people. Many people discount that they can have treatment because they've been told by a friend or a family or even some optometrists or eye doctors who aren't even aware of what we can do in the 2020s. So farsightedness, yes, that's a myth. It's common and it can be treated with LASIK. The biggest thing to do is to come in and have a free evaluation which will tell you if it's a good idea for you or not. You've got nothing to lose. I can't have laser vision correction if I've already had cataract surgery. Okay, we hear this a lot. I can't have LASIK because I've already had my cataracts out. This is another very common myth that we hear all the time, and unfortunately it's completely false. So someone may be in this situation, they've had cataract surgery 10 years ago, but they still have a prescription that they don't like. They're wearing glasses, they're wearing bifocals or contact lenses, and they feel like they're stuck with them. And it's simply not true. You can have LASIK to correct a small prescription that you have after cataract surgery in almost all cases. The average age of cataract surgery patients is going down. We're doing a lot of patients in their 60s and some in their 50s who are developing cataracts. And these people are active, they're still working, they're still doing lots of hobbies, and they really want to minimize their dependence on glasses. So if you've had cataract surgery and you still have a significant prescription, feel free to contact us. You could be a good candidate for having laser vision correction and eliminate your prescription. A lot of people just don't know about it. They don't know it's possible, and they're putting up with a prescription that they don't need to. Okay, so this is fairly common. I can't have laser vision correction because I need reading glasses. This is just plain misinformation, and the real information just isn't out there in the general public. It's been going on for 25 years or more. The situation that someone will find themselves in, I need reading glasses, so I'm not suitable for LASIK. Everyone, and I mean everyone in their 40s and early 50s, is going to need reading glasses if they are normally sighted. The natural lens in our eye weakens, and so we're not able to focus up close like we used to. We start stretching things out, and then at some point we give up and we have to go and get a pair of reading glasses. People who have had LASIK in their 20s and 30s who have been made normally sighted will also find themselves becoming presbyopic and running out of reading vision, and they'll also need reading glasses at some point in time, usually their late 40s. So LASIK can be used to help normally sighted people, including people who've had previous LASIK, to get out of reading glasses. We do this all the time, and it's called blended laser vision. A similar thing can be done with contact lenses. In fact, you can try it in contact lenses before you make the jump to LASIK. Like I said, you can come in for a free assessment of your vision, let us take your measurements, and we can tell you if it's a good option for you or not. If it's not a good option, there are other options such as refractive lens replacement or refractive lensectomy, which are very common procedures these days to eliminate the need for both distance vision correction and for reading glasses. I've already had laser vision correction, so I can't have it again. Well, almost always this is just simply not true. Most people who've had laser vision correction will stay stable for their entire life. So if they've had their distance vision corrected, they'll retain excellent distance vision over the long term. There's a small group of patients, though, usually in the first year or two after treatment, who develop what we call regression. They get a little bit of their original prescription back again, and they find that their distance vision just isn't as clear as it used to be. And in this situation, we can retreat that very simply, and then almost everybody who's got a safe amount of residual cornea left behind. At Vizon, we offer free retreatments for regression due to short-sightedness for up to 10 years and regression due to long-sightedness for up to 5 years. Now, if you've had great distance vision because of laser vision correction you had 10 or 20 years ago, but you're starting to lose your near vision, then there's an option of having blended laser vision where we can restore some of your near vision using laser vision correction if you're a suitable candidate for this. Another alternative is to have a clear lens extraction or refractive lens replacement, or what we call sometimes a refractive lensectomy, which can restore both the distance vision and near vision. And sometimes we need to do this in combination with an additional fine-tuning of the focus with some laser vision correction on top of that. So the answer is, if you've had laser vision correction before, yes, you're very likely able to have some adjustment to the focus again with further laser vision surgery. So this is a really common myth. The recovery is slow. One of the greatest things about LASIK that's made it so popular is that the recovery is in fact really fast for the huge majority of people. They'll go through surgery on one day, they'll go home, they'll rest overnight, they'll get up and they'll come and see us for their post-operative appointment, day one. If everything's okay, they've got great vision, they can get right back to driving, they can get back to work, they can get back to using the devices and reading the day following their treatment. So no, that one's completely false. The recovery following LASIK is very rapid. Even faster is the recovery following SmartSight or Smile. People can have the treatment, the vision will be blurry for a few hours. The next day, again, back to reading, driving, using devices. But the day after that, they can get back to all their normal exercise routine, including contact sports, wearing makeup, and even swimming within 3 days. I was told I can't have it. Okay, we hear this all the time. We've heard it for 25 years. Somebody told me that I can't have it. Well, who told you? Your friend, a neighbor, even an eye doctor? Well, it all really depends on their knowledge base. Do these people do laser eye surgery, or do they have patients that have had surgery done? Also, the information you received years ago may be completely out of date today. Laser vision correction has evolved enormously. You may not have been suitable for LASIK in the past. You may be now suitable, or you may be suitable for SmartSight, which is a safer treatment in thin corneas. You could even have an ICL, which could be used to correct your vision if you were told that you weren't suitable for LASIK. Another common situation is that people go to a center that doesn't even do LASIK. They only do PRK, and they're told they're not suitable for laser eye surgery because they aren't suitable for PRK. But they may well have been suitable for another type of treatment like LASIK or SmartSight. So people will end up being misinformed in this situation as well. At Vizon, we offer all forms of vision correcting treatment. So just like anything else, you want to go to a professional that actually does the surgery and who has been doing it for many years, because that way you're going to get told the right information. You may not be a good candidate for it, or you might be, but you just don't know until the measurements have been taken and it's been analyzed by a surgeon who can offer you the full range of treatments and be able to match you up with the treatment that's going to be exactly right for you. So don't just take people's word for it. Come in, have an assessment, it's free, and we can tell you if this is a good idea for you or not. Well, this is a big one. Wearing a contact lens is safer than what? One thing that people really don't understand about their contact lenses is that they are a foreign body that sits on the surface of the eye that can constantly be a source of infection of the cornea. So there are several studies that have been done that show that long-term contact lens wearing can be more dangerous than having LASIK. Approximately 2 years of wearing contact lenses is the equivalent risk for having LASIK. So if you sleep in your contacts, the increased risk of infection is 8 to 40 times as much again. That's not 8% or 40%, it's 8 to 40 times as high. So doing things like sleeping in your contact lenses really is dramatically more risky than having a laser vision correction surgery. So doing things like sleeping in your contact lenses or swimming in your contact lenses really elevates the risk of developing an infection much, much more so than the risk would be from having LASIK. So this myth, it comes out quite commonly right on the day before laser eye surgery. I hear this every week, usually is right before people go ahead with laser. It's something they've been holding on to, and they're really fearful that they may go blind because of the treatment. Well, the answer is you're not going to go blind. That simply is a myth. There hasn't been one person in all of the millions and millions of cases of laser vision correction that has gone blind because of their laser surgery. It's just simply not that kind of surgery, so there's nothing to worry about on that front. We need to throw that and bury that idea away. The estimated risk of going blind in one eye after laser vision correction is between 1 in 3 million and 1 in 5 million. There's an enormous number of things that would have to not go right for that to happen. The issue is that if something is not quite right after your laser vision correction, we encourage you to contact us immediately. You've got our contact details available to you 24 hours a day. In almost all cases, if there is a problem developing and it's detected and treated in an early phase, you'll have an excellent outcome and retain excellent vision. Myth: I'm too old for LASIK. I'm too old. That just isn't true. We regularly have people in their 60s that undergo LASIK, and I've performed LASIK on many patients in their 80s after they've had cataract surgery who simply wanted to be freer from their glasses. We generally don't start treating people until they're 18, and usually we wait until they're 22 before they go ahead with LASIK or SmartSight. So most people in our practice are between the ages of 22 and 45 for having laser vision correction. That's the most common, but there are plenty of people having laser vision correction in their 40s, 50s, and 60s. These are people who don't have cataracts, who don't have a need for cataract surgery, who would be great candidates for laser vision correction rather than going through refractive lens replacement. And this all comes down to their individual lifestyle needs and whether or not they tolerate having what we call blended laser vision. And we simulate this in contact lenses before going ahead with the procedure. So in answer to this, it's simply a myth. There's no upper limit for having laser vision correction in terms of your age. If you have a healthy eye and a cornea that's appropriate, you can go ahead and have laser vision correction. Okay, so this myth, eye doctors don't have it done. Well, this is false. And actually, we eye doctors are 4 times more likely than the general public to have laser vision correction. So that's a myth and it's completely wrong. In fact, not only do they have the surgery themselves, but they're also very likely to recommend it to their friends and family. So this is completely false. We do have the surgery, we enjoy the surgery, we enjoy the benefits of it, and we also encourage our family members to do it, and we perform it on family members or friends. I've done LASIK on family members and I've done LASIK on friends, and I would have it done myself if I needed it, and I likely will need it at some point to restore some of my close vision. This myth, it's a relatively new surgery. Well, it can't be a relatively new surgery because we've been doing LASIK for over 20 years. LASIK is the most studied elective procedure in the world, and there have been thousands of studies done in many nations on laser vision correction, which have shown the accuracy and the safety of these procedures. LASIK and PRK are very effective, they're highly successful, it's safe, it lasts, and people are happy with it. Satisfaction studies relating to LASIK and PRK show that at least 95% are very satisfied with the outcome of their treatment over the broad range of the population and have higher satisfaction rates compared to other elective surgeries that people commonly undergo. LASIK is also one of the safest procedures performed on the human body, and the body of scientific evidence stacks up to support this. Okay, this myth, it's too expensive. It's too expensive. Yes, laser eye surgery costs money. Everyone understands that surgery costs money, that our cars cost money, our houses cost money, but so do contact lenses and glasses. They also cost money. Several studies have been done comparing the costs of laser vision correction to the cost of wearing glasses and contact lenses over the long term. The costs of LASIK have gone down over the years. Certainly other technology has become cheaper, like cell phones and computers. The other thing that's changed dramatically is that a significant portion of patients are having these procedures financed. So we offer several financing options, even up to 2 years with no interest. So LASIK is surprisingly good value, and you may not be aware of what you are paying for glasses and contact lenses and how much that's actually adding up to over the long term. You need to find out the facts and come in, and we'll help you with that and help you determine whether or not you're suitable for having laser vision correction. You can go online and look at our cost calculator and just see how much glasses and contact lenses will cost you versus the cost of having laser vision correction. Myth: the surgeon doesn't matter. The surgeon doesn't matter, the machine does all the work. It's just completely not true. Just like cataract surgery or other microsurgeries, Laser vision correction, LASIK, is a very delicate surgery. You need to have someone who knows what they're doing, who's done a lot of cases and has experience with routine and non-routine cases. The laser certainly does a good bit of the work, but it does not do the work that is the most critical in either surgery. So the surgeon absolutely does matter. Their experience matters, their training matters, the equipment that they're using really matters, and the technical team that works with them also really matters. So these things are important to ensure that you have a successful surgery. Your surgeon really matters. So there are a lot of myths about laser vision correction and LASIK in particular. It's really important that you get good information. It's great to hear it from us in these videos, but the most important thing to do to see whether or not you're suitable and to know if you're a candidate for any form of treatment is to have a free assessment, have all the measurements done, come and see us, come and talk to an expert, and that's the only way you can determine if this is something that's right for you and makes sense, or if you're maybe unfortunately not a candidate. The best way to know if you're a suitable candidate for LASIK or any form of vision correction we offer is to book a free laser vision assessment. You can book the appointment directly on our website, or you can call us if you prefer. You can even scan the QR code you see on the screen right now, which will link you directly to our online calendar where you can choose a time and date that suits you for a free initial assessment.